coming in, been having a lot of lower back pain, getting shooting pains down my left buttocks to the hamstring, sometimes into the calf. Been experiencing some shoulder pain that's been going on for months now. Just finally got to the point where I really want to start working on it.
Okay, so lower back pain, down your leg, and shoulder pain. So let's go ahead and start with the lower back. I mean, how long have you had that for?
Been going on now for about 3 to 4 weeks.
3 to 4 weeks. I mean, did something happen?
Nothing really happened. Just gradually getting worse over time, to the point now where it's become like a sharp pain that'll shoot down the leg from time to time.
Okay, and I mean, what have you been doing? Like, what type of job are you?
Currently, I work in a facility where I do a lot of desk work, but I
Okay.
do get up and walk quite a bit. But my previous jobs, I did a lot of heavy lifting with awkward rotation, stuff like that, while carrying a load. So could have tweaked it back then.
How long have you been working in your previous job?
Worked there for 4.5 years.
4.5 years, and then you transitioned to the job you have now.
Yes.
So you're walking a lot, you're sitting a lot, just a combination of both.
Yes.
Did you feel that pain like at work? When you were
Not
on a job?
At my other job, I did from time to time, but not very often. And then getting into my new role, didn't really feel too much pain, especially
Okay.
with the walking. It was more whenever I transitioned more into the seating part of it.
Sure.
Started sitting more and more throughout the day with the desk job, and really started to feel it then.
Okay. And what have you done for it? Have you seen any providers for it?
I currently haven't seen anybody for it, but my wife speaks very highly of chiropractic work, so
Okay.
I figured that'd be a good spot to
Awesome.
start.
Awesome. What time during the day do you feel the pain? Is it like when you get up?
Generally
or is it-
worse whenever I get up, yes.
Okay. Once you wake up from bed, you start feeling that pain.
Yes.
And how's it throughout the day?
It'll slowly loosen up throughout the day, but it never really goes away fully.
Okay.
And if I have to stay seated for any length of time, usually anything over 20 minutes, it'll start to stiffen back up and it'll start hurting again.
Wow. So 20 minutes, and then you start feeling that.
Yeah.
And but you're sitting for hours. I mean, what throughout your job? What, a couple hours?
Yeah, I'll sit at any given time from 20 minutes to 2 hours at a time.
Oh wow. Now your shoulders. Tell me what happened with your shoulders.
Multiple injuries, mainly weightlifting, incorrect form, felt a pop and just kind of hurt ever since then. But it got better, and then here recently it just really started picking back up
When you
again.
say you got better, did you have like therapy on it?
I went through 8 weeks of physical therapy for it and got a cortisone shot or
Okay.
cortisol shot in it. Felt much better for a while, and then even got back into playing sports. And then it was just, like I said, I think probably 3 or 4 months ago, started really acting up again. At that time I was in a car accident.
Oh, okay.
Got rear-ended. I didn't see it coming, so thankfully I didn't feel much, but that arm did come back and hit the pillar, so I'm wondering if maybe that had something to do with it.
So how were you driving? Did you have your hand on the steering wheel, or?
Honestly, I can't remember from whenever I was sitting. I just remember sitting at a stoplight and I looked to my left, and next thing I know, I was almost in the back seat. So
Yeah, so you looked to your left, and that's when you got hit.
yeah.
Okay. And from the car accident, did you get any care for that?
I did not. I experienced a little bit of stiffness in my neck and upper back, but nothing really major that I thought that I needed to seek care for.
Yeah. So lower back pain going on for quite some time. You had it at your old job, but up until now, you're starting to feel that pain.
Yeah.
And now the shoulder, the left shoulder, that's bothering you. Okay. So let's go ahead and do our exam and see what we got going on.
Okay.
You can go ahead and grab it right there. As we check the spine, one of the reasons why we have our patients gown, or the guys with their shirt off, is that we can see if there's any swelling, if there's any redness, if there's any blemishes that could tell us, hey, maybe there's a shift in your spine, right? Because whenever you do have a shift in your spine, that causes inflammation, it causes edema, it causes swelling. And so we use all of those different indicators to tell us, hey, is there something going on? Because we want to make sure that what we're adjusting is what the actual problem is, versus, hey, I think it feels good here. Um, but we have a reading at the base of your neck. Is something happening? You got a scratch trigger.
I had an itch earlier.
Oh, okay. Reading around T1910. Right there. Around that base here. Do you have any are you experiencing any neck pain or any migraines or anything like that?
Not here recently. In the past, I have had migraines. I was getting a migraine at least once a week. Now I maybe experience once a month.
Definitely.
It's definitely not fun.
Hey, but you're here now?
Yeah.
How's that fella right there versus that bottom?
Bottom one.
Okay, what I'm going to do is rock you back and forth and see how the lumbar, your lower spine feels. Alright, my head, you bend forward and touch your toes. Come back up. Left side, so as you bend forward, go ahead and bend forward again. Left side raises up, which tells me, hey, left pelvis is fixated with your sacrum, and so that's usually, when you bend, your pelvis should be separated from your sacrum and your lumbar spine.
Mm-hmm.
And so when it's fixated like that, it's gonna drag the pelvis that is fixated is gonna drag along with your lumbars. So that's what we picked up on the left side and your sacrum. So I'm gonna have you go ahead and stand up. And let's figure out, hey, is it your pelvis that's the problem, or is it your sacrum? Okay. I'm gonna have you lift your left hand for me. Left knee. I'm sorry. All right. Bring it down. Let's do the right side.
Back balance.
Yep. Let's do left side again. Good. And right side. All right. So what I'm feeling is that your pelvis moves fine. It is a little fixated, but what's really fixated is your sacrum. It's not moving at all. And then if I go on tenderness, it's not as tender, feeling up and down your SI joints, but right over the sacrum, it's where you feel that pain right there. So we have, let's see. 1, 2, 8. T12, sacrum, and C7 right there. The first thing we see is that there's multiple levels of disc degeneration throughout his lumbar spine. Second is the structure of the sacrum. By the structure of the sacrum, we can tell that the sacrum has adapted to the stress of the lower back. This x-ray confirms that the sacrum is a problematic area, which matches up with the exam. Go ahead and let's work on your lower back first. Go ahead and lay it on your side right there. Bottom leg straight. Okay. Then the top leg. Okay. Come on up. What is this tattoo? On the
It's a runic for good luck.
That was it.
Mm-hmm.
Alright, I'm taking you up. So what's the matter, right? Alright, I'm gonna have you walk it off. Walk back and forth a couple of times. How does that feel?
Feels good.
Yeah? What are you feeling?
Feeling a little looser in the lower back.
Mm-hmm.
Neck definitely feels looser. Back doesn't feel as stiff. It just feels like there's not as much pinch in the lower back.
What about that that sharp pain shooting down your leg?
I'm not experiencing it right now. I mainly experience it sitting down.
Okay. For about 20 minutes, and that's when it comes down?
Yeah.
Okay.
I'll start coming down the leg pretty good.
Did you have trouble sitting up and sitting down?
I did. Here recently it hasn't been as present.
Okay.
I am struggling crossing my left leg over my right leg.
Okay. Let's
Just,
see if you can do that.
It's just the
Just like when you're tying your
when you're tying your shoe, trying to put your sock on, just
Okay.
get my leg up here. Like I feel like it's harder to pull it up,
Okay.
and then I can feel like just sitting like this, I can feel the muscle pull, like the tightness.
Okay. And that was about the same from before?
This is actually pretty easy right now
Yeah.
compared to what it is. Normally there's a pretty good amount of pain.
Mhm.
So right
Go
now,
ahead, switch your legs and see if that
and this one doesn't
doesn't bother. So it's
No.
mainly the left side.
Yeah, it's the left side that will get it.
Okay.
Yeah.
So what I recommend is icing. Okay.
Okay.
Whenever you get home, ice 3 times a day for 20 minutes each. All right. It's gonna be mainly in this lower this mid area in the
Yeah.
lower back. Ice that right there. I'd say lay off on any like major exercising or anything like that. You can definitely walk. I definitely
Yeah.
recommend walking, but your job calls you to walk a lot, so you
Yeah.
know that is beneficial. When you do sit, make sure that you're sitting with proper biomechanics, right?
Mhm.
Most of the time, you know, when people have desk jobs, they tend to slouch down over time like that. But what happens is that that lower back just rounds out and rounds
Mhm.
out and rounds out. But make sure you're sitting nice and tall. Don't kick your foot up on anything like that. Just maintain nice curve. I mean, you don't have to sit like that, but make sure you're sitting up nice. Okay.
Okay.
Well, let's go ahead and actually check out your shoulders too.
Okay.
Go ahead and grab a seat right there. I'm just gonna bring your both arms to the side.
Okay.
Just drop your arms right there for me. Just relax those arms.
Alright.
I got it. Yep. I'm just gonna lift this up. How's that?
It's fine.
Does that bother you?
No.
Okay. Go ahead and put this here. I'm just gonna rock your arms.
Okay.
Alright. We're gonna go ahead and check your scapula. So you come on this way. You can just sit right there. What I want you to, we're gonna touch your good arm first. So
Okay.
go ahead and take your arm and put it behind your back and reach up as far as you can with your thumb. All right, goes here. Go ahead and relax this arm. Let's do your left side.
Okay.
All right, you can go ahead and relax. I mean, it's about an inch difference. Did you feel like it was a little bit harder to use your left hand?
Yes.
Okay, let's do your right hand over and up on your back. Reach far down as you can. All right, let's go ahead and relax this arm. Let's do that arm. Yeah, so you do have some limiting motion on the right shoulder. And we're just checking the position of your scapula. And a lot of times, when we do have injuries to our scapula, a lot of times that scapula or your shoulder blade can come up and out like that.
Okay.
Right? Or it can come up and go inside like that. And that's what we're checking for. Go ahead and relax your arms on your side and take a couple deep breaths in for me. At the base, we can see that the base of the shoulder blade, it kind of has rocked out like this.
Mm-hmm.
Okay. So I would say that's a lateral scapula. Let's go ahead and adjust this. We'll get you back on over here. Let's take this arm, put it behind your back. Is that okay?
Mm-hmm.
Yeah. Good. I'm just gonna do it a little bit more. Back over here and grab a seat. Let's go ahead and test let's test that again and see how much of a change we got. So let's do right arm first so we can see the difference. Yep, behind your back. Good. Okay, right here. Let's do left arm. Man, right there. They're about even now. That's awesome. Let's do right arm behind your back, above. Okay, let's do the left side. Nice. Well, would you look at that?
Feels good.
Yeah.
Yep.
Okay. Well, we're all set for today. So I'll see you next time.
All right.